We see over 10 botched knee replacement rehabs every single year. So we're gonna go through the 5 exercises that you need to do. They're safe, they're effective, and we're gonna make sure that we focus on extension, which is the most important thing that we get. So we're gonna jump right into that, and I'm gonna have 3 things at the end that I gotta make sure that you focus on. If you know where your North Star is, then you're gonna be successful and you're gonna be walking strong after this knee replacement. Now, extension is the most important thing that we get after our knee replacement. When I'm walking, my knee has to fully extend so that I unweight, I unload the muscles around the knee. And so we're gonna focus heavily on that. And sometimes you get that at physical therapy and a lot of times you don't. They're not totally focused on it. They'll focus on the quad, but they're not focused on making sure that knee gets into full extension. If you don't have it within the first 2 weeks, a lot of people build up scar tissue. So we're gonna make sure that you're getting that. So extension is key, that's number 1. So let's get in the first exercise is that we're gonna look for extension. And so we call these short arc, well, not short arc quads, we call it a quad sets in a straight leg raise. So what I'm gonna do is I'm gonna lay down and I'm gonna get here. I'm doing a quad set, so I'm squeezing my knee, I'm squeezing my leg down, pushing my knee into the table right here. So I'm getting that warmed up. You may not be getting that far, you may get to here, but at least you're trying and we're firing up that quad muscle. We're pushing down. This knee, my right knee is bent, my left knee is totally straight. And then I'm gonna lay my head down, and as I get my knee into as much extension as possible, I'm gonna raise it up and get it to the even point with my other knee. I'm gonna hold that extension, and then I'm gonna rest for 2 seconds. And then I'm gonna push that knee down, and then I'm gonna raise it up, and then I'm coming back down. There's a huge focus to relax, and then push that knee down as tight as I can get it, lift it up, make sure I have full extension as much as I can get it, and then lower it back down. And we're gonna do that 10 times. Relax it, push that knee down, raise it up, getting up to the other knee, make sure I keep that extension, and let it back down. This is slow and controlled. We're doing 10 of these, and we're really making sure that we're getting that quad to fire up. And we make sure that we're going down, that's eccentric load. We're getting more engagement as we're going down. So we really just gotta focus on making sure that quad's fired up. Remember that we have 4 quad muscles. They're gonna push my knee into extension, but they also, one of them is a hip flexor. So we're hitting that in exactly the way that we need to. We've got to do this consistently. In the first 2 weeks, it's very, very important that we're working on these exercises. Let's jump into number 2. Number 2, we're gonna work on this thing called a short arc quad. So I'm gonna have a pillow right here underneath my head. I wanna be comfortable. We should be comfortable while we're doing this because it's not comfortable moving your knee in these areas after the knee replacement. So let's make sure that we get comfortable. This pillow is just, you can fold up a pillow. We just want something underneath our knee. So I'm laying down, I'm gonna put this underneath my knee. If you need some help with that, have a family member, throw it underneath your knee right here. And then now I'm gonna rest down and I'm pushing my knee down. I'm pushing the back of my leg down into the pillow and raising my leg up. You can make it short. This is a short arc quad. If you were doing a long arc quad, then somebody would be right here and coming all the way up. We don't need to do that right in the beginning because that extension is the most important thing. So I'm gonna go ahead and double up these pillows right here so you can see it. So I'm gonna raise it up a little bit more. I should get a little bit more engagement right here. So this knee stays bent. I'm pushing my lower leg down and I'm getting it totally straight. I'm gonna hold that for 5 seconds and then I'm gonna slowly lower back down. Remember, all this is gonna be uncomfortable, but that's okay. We gotta push through this. The first 2 weeks is so important that we're getting that quad fired up and then we're making sure that we're getting full extension. We have to get full extension. So a lot of times after these knee surgeries, we're gonna do 10 of those. We're gonna do 5-second holds when we get to the top and we're gonna slowly lower down. Remember, after surgeries, we have a trauma and our quads tend to turn off and we've gotta wake them back up. We gotta wake them back up quick. And I really implore you, we talk about our clients with this because we have such good outcomes with knee replacements, it's to not sleep with your knee in this position. We cannot sleep with our knee bent, because if we're healing through the night and our knee is bent, if you have to start like that and you start like this, then within the next 2-3 days, we need to go down to a smaller pillow, and then we need to go down, and we finally, within the first week, we got to start sleeping with our knee as straight as we can get it. You got to get good sleep, but make sure that you're making that pillow go down, and so that we're healing in a more lengthened position, or it's going to cause us problems and it's going to slow us down in the long run. And this is the most prevalent reason, most consistent, for people having to go back in under the knife and get scar tissue cut out, because they don't get full extension back if they don't get it in the first month. But the first 2 weeks is the safest way to go about it. So those short arc quads, we're gonna do a set of 10 5-second holds, and that's it, right? Because we're gonna do these exercises twice a day. If you do them 5 times a day, nobody's gonna get mad at you, but twice a day is absolutely a non-negotiable. Number 3, we're gonna loosen up the hamstring. So these muscles come down, the hamstrings come down and cross the knee. And so we gotta get a lot of tightness on the backside of the knee. And probably the most common problem that I've had with clients is irritation in the hamstring. When we get to weeks 4-5, that's really the only thing that's remaining. And it has to do with that their quad just isn't firing up enough, or they're too tight in those muscles. So what we do early on is we'll take a lacrosse ball and we'll put it right here underneath the hamstring. We'll do it off to the side. We'll do it right in the middle, and then we'll do it on the inside. And we make sure we loosen up that muscle. Great to do on your countertop or a hard chair. This table's okay, but I'm gonna get it right to the edge. I'm gonna sit down. Now I'm on the outside first, so I'll do it right here so you can see it pretty good. I'm gonna get right here. I'm gonna keep my back in a neutral position, and I'm gonna push down and right over that ball, pushing into the hamstring, and I'm gonna extend the leg. Nice and easy. You do not have to come fully straight on this one. The first two, we're trying to get as straight as possible. On this one, I just want that tissue gliding over the ball so that I'm loosening up that hamstring. This is gonna pay dividends in the end of the first week. When we start doing that really, really consistently, we're gonna be loosening up those hamstrings. If you're going to physical therapy and they do not put their hands on your muscles, if they don't dig out muscle tissue or dig out that hamstring, you need to find another physical therapist, because they're causing you problems that will be your downfall. Do not allow a crappy PT to work with you and put you in a bad position. We have to assume that the surgeon did a good job, and then the PT has to do a really good job, and they have to put the effort in, and they got to talk to you, and they got to put their hands on those muscles and loosen that muscle tissue up, or you're at the wrong place, you're working with the wrong person. And remember, subscribe and ask us questions on exactly what to do. We can be a surrogate. We can help you out here online and make sure that you're not in that position. We've had clients that come in 6-9 months after a knee replacement where they still can't get full extension. They still can't flex their knee all the way. They're having pain every day. That's a really bad position to be in when you've been dealing with pain for probably a decade already. You know, we're getting to the middle of the hamstring right here. Put that pressure on it. If it's too tender right now, and then you don't have to put that over pressure, just nice and easy glides. We're doing 10 of them in each spot. I'm gonna get on the inside. I need a little bit extra pressure, but I didn't just have a knee replacement. So we want to be gentle with it. We want to be gentle and consistent in doing the right exercises. So just doing 10 right here. So that was exercise number 3, where we're rolling out the hamstring. So we're killing 2 birds with 1 stone. We're loosening up muscle tissue, and we're still working that quad. So let's get into exercise number 4. Exercise number 4, we're gonna do a straight leg raise. So straight leg raise, I'm getting that knee as extended as possible, and I'm using the glute. We don't wanna leave the glutes behind. We gotta make sure that we're getting our glutes fired up, because this motion, pulling out to the side, is coming from my glute muscles, and that is what's gonna make sure that my femur stays over my tibia. So I want that knee lined up right over the tibia. I need that knee, the bottom bone lined up over the top bone or under the top bone. We want to keep them straight. That happens with the glute. I see this so often when we deal with a botched rehab, is that people forget the PTs, they're young, they don't have any experience, and they're just going through the motions, and they forget about working on the glute. And so I would say The extension is probably 60% of the time, and then the glutes, not doing glute exercises, probably the other 40% of the time is that they just forget about the glutes. It is absolutely integral. We gotta work on the glutes. So what I'm gonna do is I'm gonna take a band. If you don't need a band, if you feel a lot of fatigue already, like you don't have to use a band. So let's do it first without the band. So what I'm gonna do is I'm gonna stack my knees and I'm gonna roll my body forward, tuck my tummy, and then I'm gonna straighten this leg out and I'll push it up and back into this position. Make sure that you're not feeling activation in your low back. We shouldn't be feeling it there. It should be all right here in the butt. So I'm pushing back and I'm holding that for 30 seconds. And then I'm gonna totally relax and let it sit back down. Rest for 10 seconds. And then I'm gonna do another 30 seconds getting that perfect position. That perfect position comes from rolling forward, tightening the tummy, and then extending that leg straight as far as I can get it with my knee. And then I'm pushing up and back and trying not to allow my low back to get involved. And I do that by keeping my core tight, and also don't roll back like this. Then we're using hip flexors. We gotta stay stacked and a little bit forward, and then I squeeze and push that leg as far back as I can comfortably, keeping that knee straight. Now I'll show you what it looks like. We're just doing 2 sets of that, 2 sets of 30-second holds. Now with the band, we wanna get to where we're putting some external load on it as quickly as possible. So I'm gonna lay down right here, stand stacked, roll forward, tighten in the tummy, straighten that leg out, keep the tummy tight, push back and up at the same time. And I'm squeezing, trying to crack walnuts with those glutes. We get those glute muscles so fired up that they'll never turn off again. That's what's gonna protect our knee. We got a couple things we gotta focus on. These glutes are really important. So I'm squeezing, pushing up and back, squeezing in the abdomen, squeezing in the glute. I really wanna squeeze as good as I can so that I get that really good burn. After a knee replacement, we really want our clients, they have such a high success rate because their glutes are sore for 2 weeks. We're using them every single day, twice a day. If you're doing it 5 times a day, I'm not gonna get mad at you, but twice a day, non-negotiable. Also, should you be doing it on your other side? Absolutely, because your unaffected leg is gonna get beat up because it's doing so much work. So we wanna work those muscles on the opposite side too. And most of our clients have one knee that is really bad, that they'll get the knee replacement, but the other knee is not good. So we've been able to prevent knee replacements on the other side because we always do our exercises bilaterally. We always do each side. So exercise number 5, we're gonna work on a hip hinge. So a hip hinge is where I'm pushing into my butt. I'm allowing the knees to bend, but they're not shifting forward. And what that does is it allows us to unweight our knee and really push that pressure into our glutes when we're bending over. And so we got to get really good at this motion. So I'm going to get this table over here. You can see as I push back. So I'm always measuring about my foot length from a table or a wall. And then I'm going to keep my face in line with my chest. My lower leg stays vertical and I'm reaching back with my butt. And so right there, I could sit down into it, but this isn't about a down and up motion. It's really about a backward and forward motion. So I can get a little bit closer and get my hamstrings to touch the back right there. And that's totally fine. As long as my chest is coming down and my butt's coming back and that's evening out my pressure so I stay balanced. My weight is on my heels more. So I'm pushing back, I touch, I push forward with my hips, I push back with my hips. Make sure that we don't have our eyes locked on the wall because now I'm using my low back muscles. Make sure that we don't bend first with our knees because if I bend first with my knees, now I'm putting pressure on my knee. That's gonna hurt. You'll know real quick if it's bad because it's gonna start hurting in your knees. We gotta make sure we're not doing that. We start with pushing our hips back, allowing our chest to come down, get to about here, and push forward with the hips, backward with the hips, forward with the hips, backward with the hips, forward with the hips. You should feel that in your hamstrings and your glutes. We're firing up the correct muscles. We've been doing sets of 10 with this. This one I want you to do 3 sets of 10 because this is a movement pattern. We're retraining our brain to move through these productive patterns. So to sum everything up, so extension is key. We make sure we get extension. Number 2, make sure that we're getting soft tissue work, that you're doing it at home and that your PT is doing soft tissue work. If they're not gonna do it, find a massage therapist that does a good job to loosen that up. You need all hands on deck. We gotta make sure that we only do this surgery once. And then number 3 is don't forget about the glutes. Make sure that we're firing up the glutes and we're putting ourselves in a great position to not go back and have to do this surgery again. Make sure that you hit the subscribe button, leave us questions or comments, let us know exactly what you need, and we'll make sure that we give you the content so that you're not going back under the knife. We'll see you in the next video.